School health services. Young children are prone to many diseases. That means that young children are vulnerable. Their age and their body capacity allows the germs and bacterial infections to attack them sooner. So it is very important that the school provides some health facilities so that the children who are in the school are protected from bacterial and viral diseases. In the developing countries where health services for the general public are usually poor and overall knowledge about healthcare is low, parents and teachers are unable to detect health problems of children which impede their learning as well. So it is sad to know that places in the developing countries, especially some rural places and also some urban places in the developing countries, they are neglected of any school health services. There are no school health services available there. According to the project report, it says that there are some areas in the developing countries where the school health services are not available. Not only the services are not available, rather there is no awareness of the school health in the school or at home. So the parents are not aware that what are the issues of the health which are concern for their children. Also at the same time, the general public are so unaware of the system of the health services that they do not really ask for those services at all. Parents and teachers, they are unable to find out what is the problem with the health of the child or the student. Especially the mental health is not at all taken care of. So many times there are people who mislead and misguide the parents because the student is suffering from some or the other complex in the school, and they lead them to be using other supernatural powers to treat their children. Instead of finding out what is the exact problem with the child, they are misled, and sometimes these children, they suffer all their lives. What happens to these children is that they are unable to learn because their focus becomes their issue with the health. They are more concerned with that issue, and for that matter, they are not able to concentrate and focus. Unfortunately, in such conditions, the teachers also neglect the health of the child, especially when it is not a symptom which is very obvious. The teachers also are unable to detect what the problem is. Only those symptoms which are very obvious and the teachers and the parents are aware of that disease, only that seem to be cured. But also for those illnesses, the parents have to travel far off distances because there is no health unit nearby. Sometimes because of the parents being at a lower economic status, they are unable to reach the hospitals in the city. So therefore, all this information regarding the health education is most important in those areas where health services for the general public are poor and rather negligible. And also the knowledge of the parents and the teachers is very low. They do not know what is the cause of the disease. Sometimes they do not even identify what disease it is. And especially for the mental diseases, they have no understanding of it at all. So a lot has to be done in those areas where this awareness is not existing. Overall, it is the awareness which is most important regarding school health services. If the students are aware of the health services and if they understand how important they are to be in the school, then they can always ask their school authorities, and the parents can also pressurize the school authorities to have the school health services in place. Not only that, there are so many educational programs through which the students would come to know about so much of health and the related issues that they will be able to take preventive measures. So it is not in these days so difficult to spread this awareness amongst the students and the parents. All these things are online and they are available resources, And also there are so many pamphlets available that the teachers can try and make it understand and spread the awareness amongst the students and the parents to make them knowledgeable about the diseases and their causes and how to prevent those.